Hey, and welcome to Medibles, where I talk about medicine, mindset, wellness, and so much more. I hope you stick around with me and learn something new today. Now let's take it to the whiteboard, where I will discuss all you need to know about schizophrenia, including what it is, the etiology, symptoms, diagnosis, and treatment. Schizophrenia is a mental illness that affects an individual's ability to perceive and interact with reality. Schizophrenia can affect all spheres of a patient's life and disrupts their ability to think or behave properly. According to the World Health Organization, schizophrenia affects approximately 24 million people worldwide. Solely in the United States, schizophrenia affects 2.8 million adults. The average age of onset of schizophrenia symptoms is typically between the ages of 18 and 25 years old. Women with schizophrenia, on average, develop symptoms later in life compared to men. There isn't one particular cause that is responsible for the development of schizophrenia, and it is due to a combination of factors. One of the factors that play a role in the development of schizophrenia has to do with imbalances in dopamine levels in the brain. Dopamine is a neurotransmitter that is involved in functions such as memory, movement, pleasure, and reward. Some risk factors associated with the development of schizophrenia is having a family history, particularly a first-degree relative such as a parent or sibling, environmental factors, and recreational drug use. There have been some studies done that suggest a link between cannabis use in adolescents and teenagers and the development of schizophrenia. The idea behind this is that adolescent brains are still under development and are sensitive to the effects of substances. However, although a link is suggested, particularly in teenagers with a genetic predisposition, it is uncertain whether cannabis use can just be a triggering factor for the development of psychosis seen in schizophrenia. I'll link some recent research articles I can find on the topic below, in the description box in case anyone wants to read up on the topic. The symptoms that are experienced in schizophrenia can be divided into three major categories, which are positive symptoms, negative symptoms, and cognitive symptoms. Think of positive symptoms as an addition of symptoms that should not be there or weren't there previously, whereas negative symptoms are behaviors that should be present but are not due to disturbances in the patient's normal behavioral patterns and emotional state. Cognitive symptoms disturb the patient's ability to function normally, such as making decisions, concentrating on tasks, or learning. The positive symptoms of schizophrenia include hallucinations, delusions, and disorganized speech and movement. Hallucinations and delusions are placed under the classification of psychosis in schizophrenia. Hallucinations result in a false perception of reality that can involve any of the five senses, so patients may, for example, see, hear, or feel things that aren't there. Auditory hallucinations, or hearing things or people that aren't there, are the most common type of hallucinations that are present in patients. Delusions are false beliefs. A common delusion, also known as persecutory delusion, is the belief that someone is out to harm the patient. Negative symptoms can result in the patient becoming increasingly withdrawn over time from friends and family, as well as limitations in speech and facial expressions, which is known as flat affect. Patients can also exhibit depressive symptoms such as disinterest in participating in activities they previously enjoyed. Hey, your friendly neighborhood doc, just checking in. If you feel that you or someone you know may be experiencing any of the symptoms described in today's video, please speak with your doctor or a licensed mental health professional. According to the DSM-5, in order to be diagnosed with schizophrenia, two of the symptoms I described previously must be present, and at least one of those symptoms must be either hallucinations, delusions, or disorganized speech. So essentially, at least one positive symptom must be present to receive the diagnosis of schizophrenia. Also, the patient should be actively having symptoms of the illness for at least 1 month and should have started exhibiting these symptoms at least 6 months ago. If the constellation of symptoms has been present from 1 to 6 months, then the diagnosis of schizophreniform disorder is given. If the symptoms are present for more than 1 day but less than 1 month, the diagnosis of brief psychotic disorder is given. So timing is important when it comes to diagnosing patients with schizophrenia. Something to keep in mind about prior to diagnosing a patient with schizophrenia is to make sure to rule out any causes that can result in the symptom presentation. There are often substances, medications, or other medical conditions that can have psychiatric effects and mimic the positive or negative symptoms seen in schizophrenia. This is quite applicable to all mental health diagnoses in general. Lastly, I want to close out today by discussing the treatment for schizophrenia. The most commonly prescribed medications that are used in the treatment of schizophrenia are antipsychotics. Antipsychotics can be divided into two categories: first-generation and second-generation antipsychotics. Second-generation antipsychotics are also known as atypicals. First-generation antipsychotics work by blocking dopamine receptors, particularly D2 receptors, which effectively treat positive symptoms such as hallucinations or delusions. However, there are a number of side effects that can present when taking these first-generation medications, such as tardive dyskinesia and extrapyramidal symptoms. Tardive dyskinesia doesn't present right away and can take months or even years. Tardive dyskinesia presents in patients as involuntary movements typically seen in the face or extremities such as hands. Once tardive dyskinesia is present, the patient is tapered off the first generation and switched to an atypical antipsychotic. Another side effect is extrapyramidal symptoms, also known as EPS, which can present as muscle spasms or feelings of restlessness. Compared to tardive dyskinesia, EPS symptoms present more acutely. Atypical antipsychotics have a better side effect profile compared to first-generation antipsychotics. However, they are not side effect free. Some side effects of second-generation antipsychotics include the development of symptoms such as weight gain and diabetes that comprise what is known as metabolic syndrome. In addition to antipsychotics, psychotherapy can aid patients with the management of their condition. Electroconvulsive therapy, also known as ECT, is used in treatment-resistant schizophrenia and is typically reserved for patients unable to feed or take care of themselves, at high risk for self-harming behavior, or those with catatonia. That's all from me today, but if you're enjoying this type of educational content, be sure to like, comment, and subscribe to stay tuned for much more to come. If you have suggestions on what you would like to see next, drop them down below in the comments, and I'll try to make a video on it. Here are some other videos I thought you might like and my latest upload in case you missed it. Until next time. Bye.